Good evening, everyone, and welcome to Wellness Matters. Whether you are a professional athlete or whether you exercise occasionally, you are prone to sports injuries, and hence the topic for tonight's episode. As always, we are very eager to engage with you, so do post your comments and questions in the live chat, and don't be shy. And to answer your questions and mine, it gives me great pleasure to welcome Dr. Ghazwan Maki, who is a consultant orthopedic surgeon at the American Hospital. Dr. Maki, great to have you with us tonight.
Hi, thank you very much. Thank you for joining you today. Let me join you, and I'm looking forward.
We're looking forward as well for tonight's episode, but before we start, let's tell the viewers a little bit more about you. Of course, Dr. Ghazwan Maki, you have 20 years of experience in orthopedic surgery, specializing in the shoulder, elbow, and hands. Dr. Ghazwan Maki has also worked as a consultant orthopedic surgeon at the Copenhagen University Hospital in Denmark, and is a registered orthopedic surgeon with the British General Medical Council. Dr. Ghazwan, we would like to start with 10 quick questions.
Yeah. I'm ready.
Are you ready? It's going to be fast.
Yeah.
I want concise and short answers. Let's start first with why you chose sports medicine.
It's to put people back on the track. It's needing maybe a small surgery or a small treatment, and then they're back to their lifestyle. Nice.
So what's the biggest career accomplishment?
I think I have obtained 3 Scandinavian orthopedic board certificate from Denmark, Sweden, and Norway. It was a big accomplishment for me.
Congratulations.
Thank you very much.
So what's the most common sports injury you see?
Shoulder.
What's the easiest to treat?
Shoulder.
And the hardest to treat?
I would say elbow.
How about the most painful orthopedic surgery?
Knee replacement.
What sports are associated with the most injuries?
Well, weightlifting or gym activity. Yeah.
And what's a fun fact about sports medicine that many people might not know?
I think sport medicine is the most misunderstood field. It's not only for elite and professional athletes, it's for everybody.
And what are your 3 top tips for choosing an orthopedic surgeon?
Highly experienced in his field, repetition and reviews, and he works in a respected place.
And have you treated any famous people?
Well, I did. Yes.
And you can't share the names, I assume?
No, unfortunately.
Unfortunately for us, we would like to know. Anyway, Doctor, let's start with a fun question first. Yes. Regarding what we usually see on the field. So sometimes on the field, whether it's a basketball game or a football game, when an athlete is injured in the field, we see that the first aid that is administered allows him to get up and join the game again. So what kind of first aid is usually given to the athlete which would allow him to go back to the game so fast?
Cold, icing. It's decrease the inflammation in the area, decrease the pain, decrease the swelling. So as soon as we get in sport injury, icing is number 1.
So now let's start with the common sports injuries that you see. What are the most common?
As I am subspecialist in shoulder, so I see mainly upper limb, I see shoulder, I see elbow and hands, but mainly shoulder.
And now, some of those common injuries of the shoulder are dislocated shoulder, among other injuries.
Yeah.
So if you suspect a dislocated shoulder, let's say, can you first explain what a dislocated shoulder is, and what's the first course of action if you face such an injury and you're not in the hospital yet?
Yeah. Shoulder dislocation, if we have a sample here, shoulder dislocation is to get the shoulder ball out of the socket. You know, as a joint, we have a ball, so the ball is moving out. So this dislocation. Of course, we have front dislocation and back dislocation. The most common one is the front dislocation. So this is the dislocation. And how we diagnose the dislocation? Number 1 is from the injury. The injury can let me expect which type of injury happened in the shoulder, which is dislocation. For example, fall on a stretched or outstretched arm. And I can see also the shoulder doesn't look normal. The ball is out of, so I can see an empty space, for example, pain, severe pain. So this is the diagnosis, because I am out in the field, so I will not try to put anything back. I just want to see it look like a diagnosis. So this was the question. So therefore, I'm not expecting I have an X-ray. I'm not expecting I want to examine. Just look, he's in pain, severe pain. The joint is locked, and so I tried just to immobilize it before I transfer the patient. So to a hospital, for example, to take an X-ray or to reduce the dislocation.
We will talk about going to the hospital in a second, but at the very beginning, when the injury occurs, let's say the injured person does not have a doctor around.
Yeah.
What should they do
to
stabilize the injury until they reach the hospital?
They can use a sheet to fix the arm around the waist, for example, or around the chest. Just not to move it, just to keep it as it is.
Okay.
And put maybe ice, if they have an ice or anything cold, in a bag, and they put it on the shoulder to reduce the inflammation, reduce the pain. This is the only thing they need to do.
So now we reached the hospital.
Yeah.
And we asked for an orthopedic doctor. So how will the doctor treat this injury?
We take an X-ray. We just want to exclude there's a fracture with the dislocation, and we have a maneuver to put it back, of course, after we give the patient some sedation. So we reduce it in the emergency with sedation.
And that's basically it?
Yeah. Yeah,
Okay.
it is back. Well, of course, after that, we look after the injuries happened, because the dislocation is not just dislocation. Of course, there is ligament injury, there is tendon injury, there is slap lesion, there is Bankart lesion or labrum lesion. On all these lesions, we look at it later. But number one, we want to put the ball back in the socket to prevent damage to the nerves, to the vessels, and to reduce the pain. Yeah.
Now, usually also if an athlete or a person has a dislocated shoulder, how prone are they?
Very high. It is high. Like people who get dislocation, they are about 40%, 50% more to get dislocation within 1 year only. Especially we are talking about athlete or sport active people, because the tendons and the ligaments is not resting enough. They will go back to their activities. So they are prone to get dislocation again and again and again. Yeah.
Now, as you mentioned, one of the more other shoulder injuries is the slap tear. So this is a more serious shoulder injury. Can you start by explaining what it is?
Yeah, slap tear, it could be related to dislocation. And slap tear, if we take the specimen here of the shoulder, this is the biceps tendon, and the biceps tendon, we usually need it down in our elbow joint, is a flexor of our elbow joint. And what happened there, when we have the ball and when we have the biceps tendon here, the biceps tendon can be dislocated from its origin. This is the biceps tendon, and here it's cut off because it's continued to the elbow, and it's dislocated from its origin. So you can imagine you have the biceps tendon is not hanging here, so it's very loose, it's unstable. So this is the slap lesion. Slap lesion is the displacement or detachment of the biceps tendon origin from the socket of the shoulder joint. Yeah.
Now, there are many different types of slap tear injuries, correct, doctor?
That's right. Grade 1 is just a fraying of the surface of the biceps. There is no real detachment. It's just fraying. It's irregularity. Number 2 is detachment. I think we can get a picture on maybe.
We have an image that you would like to explain. Yeah. So can we have please the image so that the doctor can explain the different types?
So I'm trying just to explain on the top of the glenoid cavity, the attachment of the biceps tendon. And the biceps tendon, either it's fray, number 1, or number 2, it's detaching, or number 3 is dislocating totally. Well, this picture is showing a chromium type, so it's maybe not for the slap lesion, but just to show where is the biceps tendon attached. Is on the top of the glenoid cavity, or on the cavity you see on the screen.
Okay. Now, how would you treat a slap tear injury, doctor?
Well, it depends on the type. Usually type 1 need physiotherapy, need sometimes injection in the shoulder. Type 2, this is the detachment. This needs surgical intervention because it's painful. Patient feel pain, the range of movement decrease, start to get weakness in the arm affected by the slap lesion, get a feeling of popping or instability in the shoulder. So it needs to be fixed grade 2, which is surgery, which is a keyhole surgery, or we call it arthroscopic surgery, to go inside the joint to see with camera where is the lesion and to fix it with anchors, which is a dissolved anchors. It's absorbed by the body. We fix it in the bone, and it's simply just to anchor the slap lesion back to the bone. And after that, the patient will be in arm's length for 2 to 3 weeks, then start rehabilitation, but he cannot regain his activities or sport activities before 4 to 6 months from the surgery.
Wow, that's quite a long time.
Yeah, because my surgery is to fix it. I need to wait for his healing process. I need to wait for his body to take my repair, because I just fix it, I just stitch it. So to be strong, we have to have a natural healing process, which take 4 to 6 weeks.
That would require obviously physiotherapy as well.
Definitely,
for the shoulder.
after 3 weeks, we will start
How much physiotherapy?
Minimum, I will say for 2 months, twice weekly. So we are talking about minimum 20 sessions, 25 sessions of physiotherapy. What
are the causes of slap tears, the main causes?
It's 3 causes. Number 1 is injury. It's fall on an outstretched arm, because what happened when we fall on outstretched arm, if you can imagine the shoulder, the arm is like that, so we impact the origin of the biceps, so we dislocate it. You can imagine we dislocate it out. So injury number 1, fall. Number 2 is repetitive movement. It's sport activity. It means the patient or the person who active in sport, he keep doing the same movement over and over again. Weightlifting, just imagine that jerk a barbell every day, 3 times daily for 1 hour. So overusing the area, overusing the biceps, so you can detach it. And number 3, wear and tear, because it's a cartilage, it's a band of cartilage. So it's like you drive a car and the tires every year is get worn down or worn off, and this is what happened to the. So more we use it, more injured it get, and especially so we see it, people over 40s get very easy injury or get very easy slap lesion in sport activity or when they fall, because the tissue quality is different, so it's easy to get it injured. Yeah.
Can you avoid it in any way? Can you do anything to avoid having such an injury?
Yeah, we can avoid it by. Therefore, like this, the part of the sport medicine is to prevent the injury better before we get the injury, because otherwise it will cost us money and time, and again we may not get back to the sport. Avoid it is to know how to, for example, lift weight, understand the maneuver of lifting weight, build muscle outside the shoulder joint, so you minimize the pressure inside the joint by building the deltoid muscle, by building pectoralis muscle, trapezius muscle on the back. So we have different group of muscle we can build, we can work on, so we avoid the pressure inside the joint. So instead of the ball pressed hard against the socket and dislocate the biceps, those muscles take the movement. So therefore we see the most common injuries in people who they don't know what to do.
Okay.
And or maybe if a personal trainer forced them to do something, not to get them ready for that. So yeah, I think it's wrong maneuver, and not understanding what they are doing, and they just want to be in hurry to get the result.
Yes.
So they are most prone to get injured. Yeah.
Dr. Maki, we actually have a question on the social media platform of the American hospital. So they're asking, please explain the rotator cuff shoulder injury and what is the treatment for it?
Rotator cuff shoulder injury is injury of the tendons, which are these white structures here, not the bicep. The biceps inside. This is out here. They're holding the ball of the shoulder, and if we pull this way, so it will move this way. It will pull back. We pull back, so we will move our arm up. And this is the rotator cuffs. The rotator cuff. Can imagine if the rotator cuff is detached from the ball, so it's working. We have only this one is working, or maybe part of this one, but there is weakness in the direction of the rotator cuff injured. So if the injury is here, the rotator cuff cannot pull this direction. So that people get weakness in the outside rotation. If the injury in the front, so this tendon cannot pull here because it's not attached to the bone anymore. So they cannot move this way. We can examine it when we resist the movement. Pain, they cannot do it. And when the common injury is from above, when it's injured from above, so can imagine they cannot lift up. So there's no connection here. So this tendon, when it's pulling, it's empty. It's not attaching to the bone. For example, see now, this bone now has a total rotator cuff injury. The tendon is not attached to the bone. So if this tendon working, this one is not working or weak working. So this is the rotator cuff injury. And rotator cuff injury need surgery usually in active people. In, I would say, people less than 15 age, which is active, or very individual, sometimes also depend on the activity. Like we have seen people maybe in 60s and 70s and they still play golf and they play tennis. We need to repair it. So it depends on the activity, I would say over 50, but under 50, we need to repair it. And the repair is arthroscopic surgery, is a keyhole surgery again, to stitch it back to the bone.
And recovery is how long?
It is again take longer time because you know tendons and inside the joint is a white area. It's not rich in blood, so the healing process is actually slower than the bone fracture itself. Fracture can heal faster than these type of injuries because they're rich in blood circulation. So fracture can heal with 6 weeks, but such a white injury, you can see it's white color areas inside the joint, can take up to 6 months.
Wow.
Yeah, because the blood supply.
Never get it.
Exactly. You know, you think, oh, it's just a tendon, it's not a bone, it's not a fracture. But the blood supply is very poor there, so it's take longer time to heal.
Now, one other shoulder injury as well that's worth talking about is shoulder impingements. Can you explain this injury and what can be done to treat it?
This is the most common actually injury, impingement. Impingement is injury related to overhead movement, repetitive overhead movement. And the other thing is some people, they are prone to get the impingement because they have a narrow design of the shoulder. So if we can get to this piecement again, you can imagine this area where the rotator cuff attached, when we lift up, it has to pass under the roof of the shoulder. This is the edge, this is a roof of the shoulder. Yes. So this ball has to go inside when we move up. And if it is impinging, if this bone touching the edge of the roof, you impinge, you get the pain. Therefore, the impingement is the movement in the middle arc. Like when your arm down, there is no pain. The pain is starting when your arm in the middle, when this edge start to enter the roof of the shoulder. And then when it passes, again the pain decreases. The impingement is the mid-arc movement pain. And if we get the illustration picture we have on our screen, we can see that there is 3 types of roof of the shoulder. The narrow design
that's the image we were seeing before, Doctor, right?
Exactly. Yes. Now we can use the same image to show the type of the acromion, which is acromion type 1. The roof of the shoulder is straight, and acromion type 2 is a little bit curved, and number 3 is hooked. And you can imagine, see the blue is the rotator cuff. Okay. See in number 3 how small space there is for the rotator cuff because the roof of the shoulder is hooked down. So those people with type 3 get easy impingement. Okay. And even we have seen many people, they come in 20s, for example, they're 20 years and old, or 25, just started his gym activity. And he can lift more than the other one beside him. He's 50 years old, he can lift more than him. He doesn't have impingement. And then we can take an x-ray, he has acromion type 3 or type 2. He has a narrow design. He is not designed to do weightlifting in overhead movement. He's not designed to build shoulder muscles. You know, we are not created to build muscle. We're a human being have been created and you know, we look good with the muscles and we build muscle. So therefore when we are over in this movement, we get injury if we have a narrow design.
So this would be genetic?
It's a genetic.
Yes.
It's a genetic. You know, like we are different in the shape of our nose, our shin bone, our forehead, our ears. Like a human being, we have the same number of bones, but edge of the bones or the end of the bones are different, therefore we have different shapes. And one of them is the roof of the shoulder or the acromion of the shoulder.
Now, treatment for shoulder impingement would be what?
Well, number one is to understand what happened, to maybe do MRI scanning to see what happened. Is there is any scratch in the rotator cuff? Because the rotator cuff can be scratched, therefore it's impinging, can be only inflamed. So we usually try to understand what the problem. We take an X-ray to see if there's acromion type 3. Treatment, physiotherapy, anti-inflammatory medication. When we give anti-inflammatory, we increase the space between the rotator cuff and the roof of the shoulder. This area has impingement, so get inflamed, get swollen up, so it's blocking the movement. Therefore, we can ease the movement by give anti-inflammatory. Sometimes we give anti-inflammatory in a spot by give injection, and usually we start with tablet. If the tablet's not working, so we give injection and physiotherapy. What physiotherapy does, it's not changing the shape of the bone, definitely not, but we stretch the rotator cuff. You stretch it out. It's like, just imagine an elastic band, and you stretch it out, it gets thinner, so you gain space.
Okay.
This
So you train it, basically.
I train it. I stretch it out. The tendon is like elastic band. You know, when you stretch out an elastic band, it gets thinner. You know, if you leave an elastic band for a while, get thick, and then you start to stretch it out, get thinner. When you get thinner, you take the tendon away from the roof. And this is step number 2, is the physiotherapy. This is how the physiotherapy works. And sometimes it works forever, but the patient or the athlete or the sport active person has to maintain this movement by himself twice weekly when he go to the gym, when he do any activity, because this elastic band has to be stretched out always to keep it thin. Otherwise, the bone is still there. And after it can be disappear with this regular exercising, warming up before he do go to the gym, before he do any swimming, squash, tennis, just warm up 10 minutes, follow the instruction of physiotherapy. Usually it helps for, I will say 70%, 30% it will come back. With all this prevention we try to do with anti-inflammatory, with physiotherapy, self-stretching exercise, it come back. Then we offer a surgery.
Which is what? Yeah, what's the surgery?
Exactly. We shape the bone. We change, if we take the picture of this acromion type, again on our screen, which we call it acromioplastic. It's like rhinoplastic, it's like a cosmetic thing, but it's not really cosmetic, it's functional change in the shape of the bone. We change it from 3 to 1.
Okay, so can we have the image again,
We
please?
shape the tip of the bone. We go with the keyhole surgery with a laparoscope. I have a camera, I see on my HD screen. So I remove the tip of the down tip of the type 3, I shape it away.
So it becomes more like a type 2 or type 1?
It becomes type 1.
Type 1, okay.
Yeah, because I will decide how I want it to be. So I usually shape it to be type 1.
Very interesting.
Yeah, it's very simple surgery, and it's in general anesthesia, of course. Take not more than 40 minutes, and it can change the life of the athlete or active sport. He want to go to the gym. Gym is a part of his life. Get used to it. He want to be in the gym. He feel better. He feel healthy. He feel fresh, and he maintain his work by going to the gym. Maybe take his stress out, so we can get him back. Yeah.
Now let's move on to knee injuries, because obviously with sports we have a lot of knee injuries. But what are the most common that you think we should focus on?
The most common injury of the knee is meniscal injury and cruciate ligament injury, or the ACL injury, which is the main ligament for the stability, which we see it always in football player, because they usually injure the ACL when they play very hard in the field, on the field. So ACL and the meniscal injury is the most common injury.
Let's quickly go over the meniscal tear, as you mentioned. So what are the symptoms that the patient would feel at the very beginning?
Number one, the symptoms is the patient understand what he did. It's an sudden stop and twisting in the knee joint. It's pivoting movement of the knee joint, and they get pain, swelling. He cannot extend his knee fully, and get also locking. Sometimes if the part of the meniscal, the torn part of the meniscus is loose inside the knee joint, So it works as a hinge, to prevent the movement. So get sudden locking of the knee joint. And yeah, this is the main symptoms: pain, swelling, and locking, and feeling of popping inside the knee.
The meniscal tear, can it be fixed without surgery, or it would require surgery?
No, not common. I will say the loose one, there is a loose part in the knee joint, get locked knee. It's very like serious injury, and the patient cannot walk, cannot perform his activity. So we treat it directly with surgery. But many parts, many types of the meniscal injury, which is not loose piece of the meniscus inside the joint, we treat it first with physiotherapy, because the physiotherapy can distribute the pressure on the torn meniscus, so it give it a time to heal, and there is a chance for the meniscus injury to heal, especially the one it's close to the outer edge of the knee joint. Like if we take again a specimen here of my knee joint, I can show, for example, that the meniscus injury is the blue part of the meniscus. This is the blue part, the half circle cartilage. So when it is toward the inside of the knee joint, it's a white area. There is no blood. Blood supply is very poor, we have talked about. So the healing is very low. The chance of healing is very low. But if the injury, if the tear is out to the periphery where there is a blood tear, so we call it red area. So yeah, there is a good chance of healing. So meniscal injury, if there is no locking symptoms, we have to wait. We give physiotherapy, we give anti-inflammatory, send patient directly physiotherapy. We tell him not to do the sport activity, for example, related to the knee, like contact sport. And we wait for 4 months, 3 months, 6 months, depend on the pain. And of course, we let him go back to his activities, because that's what he wants. He wants to return back.
Yes,
and then we take it from there, how it works.
Now, the other injury we were discussing is the ACL injury of the knee. Can you also run through that injury? Can you show us where that injury is on the model, please?
Yeah. ACL is the anterior cruciate ligament, which is the front stability responsible ligament, which we take it in this one. This is the white spiral shaped ligament connecting the lower leg bone to the thigh bone, which is the spiral one. Can we see it? It's the spiral one here, starting from down and reaching up. And if we take this elastic band a little bit to the side, so maybe we can see it better. Now I take it for the other side. This one, the inner one, the spiral one, we can see it inside. So, and give us the front stability. It's holding the thigh bone stable to the front. And this is the ACL. And you can imagine, like when we walk, what's holding our knee, we are not to fall to the front, is the ACL actually. So it's very important ligament. You walk, you change your steps, you stop, and this stop is the ACL. You go down from stairs is the ACL. You go down from your car, you put your leg. What's stopping you from not falling to the front is your ACL. So you can imagine it's very strong ligament, and it's a very important to our daily life ligament. And so this is the ACL. This is how important is the ACL.
It's also an injury that is usually more common in females, which I found surprising when I was doing the research for this episode.
Yeah, that's right. Because the tissue of the ligament in females is different. It's more delicate ligament. It's very soft ligament. Plus, the outer muscle of the female, again, I would say it's a little bit weaker. So the outer defense mechanism is not holding the knee joint as the men that we see do. Because when there's a good muscle, it stabilizes the ACL. It gives less pressure on the ACL. But when you don't have good muscle, so your pressure on the ACL is more, because you don't have a strong first defense mechanism.
So now what's the treatment for this ACL injury?
ACL injury depends on the activity of the person. If I ask the patient, okay, this happened because you were playing football with your kids on a weekend and you're not planning to play football again. You swim, you do bicycling, is not a contact sport. Bicycling and swimming is not changing movement. He doesn't need this changing movement. And and you will not play football again, and it's not a part of your daily life.
So no need for surgery.
No need for surgery, because what we can do, we talk about the muscle, we can build we can take our specimen again, we can build a strong muscle here, we call it the quadriceps muscle, which give a good stability to the front, because that's what we need. We need something strong from the front, enough not to sport, but enough to his daily life. The quadriceps is okay, we can do that. We can give him a good physiotherapy or rehabilitation program for maybe 10, 15 sessions. He maintain it by himself again, because like any muscle we talk about, you have to maintain it, and he can be normal. There is no problem at all.
When would an ACL injury require surgery, and very quickly, what would that surgery be?
Is sport active people, especially with contact sport. People who do contact sport a lot, football, basketball, volleyball, tennis, they need to do the ACL.
Are recovery prospects good for that injury?
It's good. It's good. There's many types of ACL. We reconstruct it. Usually we cannot repair it. It's not repairable. The ACL, when it's gone, it's gone. So we take a tendon from other part of the knee joint to be a ligament. And it takes 6 months minimum before he can return back to his contact sport. 6 months.
6 months.
Yeah.
Wow, recovery time is quite a lot in those injuries.
Yeah.
Let's move on to the back injuries. What are the most common you see related to sports? And I would assume also related to weightlifting.
Yeah, exactly. This is one of the wrong maneuver in weightlifting. They can injure the back. And injure the back is disc bulging, disc prolapsing is one of the common injuries. Spinal stenosis or narrowing, like big narrowing of the spinal canal with affecting the lower limbs, like numbness, like weakness, is a rare one. But the sport related is disc bulging, is we call sciatica pain. It's pain radiating to right or left leg, depend on where the disc is bulging. So if we take again the specimen we have here, I can show, for example, there is two types of disc prolapse here.
If you'd like me to help you, I can hold some of them.
Yeah. So here you have, for example, a good picture of a side prolapse. This is the red one, is the disc prolapsing to right or left side, exactly. Here it's it's depend on how we're holding the specimen, but let me say it's going to the right side.
Okay.
So this disc now is pressing on the yellow nerve, so the right leg is affected. So the pain is shooting down to the right leg, limping on the right leg when there is too much pressure. Depend on how much pressure. If this red bubble, if it's just touching the nerve, so it's only slight pain. If there is too much pressure, is limping, is loss of sensation, or paresthesia we call it.
We can compare these.
Exactly. The first one you have it above is bulging. You can see the disc is not prolapsing. It's not getting out of the edge of the disc. It's bulging inside. But this one also leads to pressure on the nerve, but not like the lower one.
But this would be the more serious injury.
Exactly. The more serious one is to the side.
Okay.
There is another one, maybe third one. I'll just show it to you here. This is a central one. Can you see here?
Okay.
This one is a central.
So it's in the middle.
It's in the middle, exactly. Can you see the difference?
Compared to this one on this side.
In this, exactly.
Okay.
Yeah.
Okay. So this is in the middle. It's on the spine, maybe, right?
Yeah, in the spinal cord.
Yes.
But if you can see in the spinal cord, the middle one is not a very serious one. Why compared to the side one? Because there is more space for the disc to be.
Okay.
You can see it's an open big tunnel. The other one, the one to the side, no, there's small opening. So the disc, when it's sitting out there, it's give a serious problem to the affected side, right or left.
So now, usually with discs, what's the potential of this injury healing itself, no matter how serious it is? Can it actually heal itself without surgery? It
can, because what happened, the main pressure point is the inflammation created by the pressure. When the disc is out, there's inflammation, there's rupture in the boundary of the disc. So there's inflammation. So anti-inflammatory will decrease the pressure on the nerve. The nerve will not return back, but the body will build a new wall around it to include it in the disc. So it will be there, but it will not be movable. It will be stable. It will not be touching the nerve as it does in the beginning.
Yes.
So yeah, it can heal by itself. Actually, majority of the disc problem or disc herniation, it heals by itself. Not the disc to return back, but the disc to stay there and the body build a new wall. The bulge one, if you can remember, the bulge one where this red spot was just inside, of course, is a reversible one. It's a disc bulging.
Yes.
Because when the bulge go back, well, the boundary of the disc is still there, so the pressure will be removed from the nerve. But when it's out, no, it will stay there and the body will build a new wall. So recovery is very high. Physiotherapy is one of the, let me see, golden treatment by build muscles. And again, what the muscle does, it will push the disc back, no, but we will take the pressure from the disc to the muscles. Because the muscles of the back, we are straight. We are not using the muscle of the back. Therefore, the very soft muscle. And we have to train them up with physiotherapy. So they are holding the weight. They are holding us when we are sitting, when we are driving. And we take the pressure out from the disc.
Very quickly, doctor, so it would still be okay for someone with a disc in the lower back, for example, to continue to lift weights and exercise?
Definitely, after physiotherapy, when the pain disappears. But again, this person or this patient, he has to be careful in the future. For example, wear back belt when he put any weight on his back, for example, jerks bars, for example, or lift bars or lift weight. He has to be careful next time and to maintain the muscle strength in the future, so he take the pressure from the disc. So yeah, of course, definitely he can come back, but it is alarming for him. He has to be careful in the future.
Dr. Ghazwan Maki, thank you so much for your valuable input tonight. It was very enjoyable. I certainly learned a lot, and I hope our viewers learned so much as well tonight, because I think we learned a lot about sports injuries and how we can maybe try to avoid them as we are exercising every day. Please do join us next week for a new episode of Wellness Matters, and have a great evening.